So a little bit about weight loss program that you have.
So weight loss is a question that comes up a lot. Especially perimenopausal women will bring it up a lot and they want to lose weight, and it's often when their hormones start to shift a bit, or it's at the time of their life where they become toxic. It's often our body doesn't allow us to lose weight because it's trying to dilute toxicity. So we store water and fat because our body is locking away these toxins. So what I do for my weight loss program is we of course talk about nutrition and diet and optimize the food the patient is eating based on their calorie expenditure and all the nutritional needs that they require. And then we start a detox program. And that's the number one before we even cut back calories, because often they'll start to see shifts in their weight just by making those changes.
Do you use nutraceuticals or homeopathics or some pharmaceutical drugs? Or what is the core of your weight loss program?
Well, the core of the weight loss program is that we do optimize liver, colon, and kidney function. Often we use homeopathics, herbs, and nutraceuticals to do that. We also use injections, so I do intramuscular injections of different B vitamins along with lipotropic B12, and that helps to stimulate the mitochondria and energy production. So it improves metabolism, so that woman will feel more energy as she's going through this program, because often, especially when we get more into the calorie restricted phase of the weight loss program, then they can start to feel a bit sluggish. But by adding the injections in there, it helps to keep the patient feel well.
What are the typical results that you see with patients over the dozens and dozens of patients you have seen with this program?
So of course, the more weight somebody has to lose, the more they're going to see a drop, especially at the beginning. So the most weight I have had patients was about 10 pounds a week, which is for patients who are obese. So the closer you are to your ideal weight, the smaller changes you're going to notice. But it should be a steady decrease in weight. The more weight you lose faster, it's not necessarily always the best. So we want to make sure that that patient is supported and it's done in a healthy manner.
Any side effect with your program, weight loss program?
No, there are no side effects. I mean, if their patient starts to have troubles, we then just back up and make an adjustment. So there must be something that either they're not taking enough of, or they're not supported. Maybe their liver needs more support.
So there is no side effects with your program, that's what you're saying. Okay. Is any contraindication for any weight loss program that anybody that will not be suitable for it, or anybody who wants to do it can do it? Or?
Well, I tailor it to each patient, so I wouldn't put a diabetic patient on the same program as I would a healthy patient with no chronic illness. So there have to be certain things that we think about before we start a program like this. And especially for patients with either metabolic disorders or diabetics, we proceed with caution for sure. And we don't do anything too drastic because we don't want to destabilize them.
Do you experience any yo-yo effect with your weight loss program, or you don't see that type of problems?
No, ideally we want, if that patient, the more compliant they are, the better results, of course. So this is a lifestyle change. So when we do calorie restriction, it's because that patient has plateaued with making just lifestyle changes and detoxification. And then this is a short-term program. It's about 1 month just to get them moving in the right direction again, and then they maintain the healthy lifestyle changes to maintain their weight. Of course, if they go back to eating the way they were before, then the weight's going to come back. So it's all about having a support group and sticking to your lifestyle changes.